Well, I'm going to do two things. I'm going to just look a little bit at the bill that's coming through that will be debated in Parliament on the 29th. And the second thing is I'm going to look at the evidence. So I will be covering what you've just been asking. So on the bill, even if I supported assisted suicide, and I don't, I wouldn't support this bill because there are a number of problems at the outset. We haven't seen it. It hasn't been presented to anybody. So people are supposed to look at this very momentous change and decide within a space of a few weeks. And I don't think that's an adequate time. I think even Kim Leadbeater, who's introducing the private member's bill, has said this is going to be momentous change. We need a little bit more time. And I'm surprised at the political ineptness of those who are bringing it in about that. In light of the state's handling of the infected blood scandal, Grenfell, the post office, Mid-Staffs in Gosport Hospital, and DNR notices on disabled people during COVID, is this a good idea? And I think the answer is that most people will come up is no, this really isn't. And second of all, one of the things that we've managed to do since I've been writing on this is polling. Now, a lot of the argument is that saying that, you know, from Rosie's side, is saying the majority of British people support this. And the polling that we've done, Elora's organization, LDW, Living and Dying Well, the polling that has been done there has shown that people are actually much more ambivalent about it. And that the majority of people, if you ask them, do you want a good death for yourself? People will, of course, say yes. But if you actually talk about the real ramifications, then people are much more ambivalent. 54% of those who answered the question when asked whether it should be legalized at all said they are in favor in principle, but don't think it can be practically organized within the NHS. So that's a majority of people who are at least ambivalent about it. This poll also showed that it's not a big priority for people. 22 out of 23 important priorities were tested, and 23 issues were tested, and this the importance of assisted suicide came 22nd out of 23rd, ahead of only regional devolution, which I'm sure you will agree is one of the most boring topics ever. So 4% of people identified it as a priority. There is, if we're very honest, there's a hardcore on either side who are pro and against, and a lot of people in the middle. So my second point is really that I wouldn't support it anyway, because I don't think, given the evidence that we've had, when I was writing about this 30 years ago, we didn't have the evidence really to say what's happening. Now we do, and I think it's worth looking at. What it indicates, as my colleague Theo Bohr puts it, supply creates demand. If you offer medical treatment, if you offer this as medical treatment for suffering, then all who feel that they suffer will appeal for this. And that's been the case and is borne out by the evidence now. You can call it a slippery slope if you like, but there's real evidence that if you do that, it can't be denied to anybody. How can you? If it is medical treatment for suffering, how can you deny it to children? You know, that would be a fairly awful thing to do. And of course, that's what's happened. We've seen that Belgium has extended it to children in 2014. We've seen the Netherlands in 2023 expand it to children of all ages. And Canada is obviously on many people's minds about the rapid expansion that's happening there. Even Oregon has got rid of some of the safeguards it originally put in. Twice it's extended it. I can go through chapter and verse, but I haven't got the time because I've just got a yellow card. Yes, it starts out, and the other thing that I think is important to know, it starts out as a demand for those with money and education. We've seen this sort of celebrities, really asking for it at the moment as something. But we've seen in Canada that 58.1 made requests came from low socioeconomic status patients. Whereas 41.9 came from high status. So what we're seeing is that it's being used in Canada as a way of getting rid of people whose lives are very inconvenient to the rest of us.